Well, thank you very much. Temporary restorations or provisional restorations are difficult. I think we all struggle with them. If they are in the posterior area, they are difficult. How do we make sure that they stay on, that they're not too tight, but especially in the anterior region? Because we want to give some aesthetics to our patient, but we also want to make sure that we can get the temporary restoration out and that it doesn't stick too much. So that's the topic that I want to cover today, and I'm going over different scenarios that we have for our provisional or temporary restorations. First of all, let's go over the function of a provisional restoration. First of all, it's mainly for aesthetics because the patient wants to go home looking nice. They don't want to go home with their prep teeth. Also, in order to have good function, especially when we need to redo full crowns. We want to avoid any migration in the period of our impression taking and the delivery of the final restorations. And in some cases, we want to guide the soft tissue. Temporary restorations are never for sensitivity because if we use media dentin sealing, we cover the freshly prepped dentin and people will almost never complain about sensitivity. So, for example, let's take this case. This patient had some old crowns that were there and that we had to remove, we had to redo them. And in this case, my provisional restoration is for the aesthetics, for the function, and to avoid any migration. In a different case, where we, for example, do a clinical crown lengthening, we can also use the temporary restoration to guide or support any of the soft tissues. Well, there are different kinds of preparations that we have in the anterior region. We have retentive preparations and we have non-retentive preparations. And we can also divide them in a single tooth preparation, or maybe we have multiple teeth. And for all these scenarios, we need to think of a different way to make our provisional. But first, let's go over the provisional itself. What do we need to make our provisional restoration? Well, first of all, we need a really precise body index. Usually my dental technician makes them on the wax up, as we see here on the top right. But we can also make them in the mouth. So maybe we don't have a wax up, patient comes in. What we can do, we can take a putty, we can make an index, and then we can use some light body impression material to reline our body index to make a really precise copy of the intraoral restoration. Well, then we have our index, but we also need our material. So we need a temporary crown material, for example, Visalis Temp. Sometimes we need a temporary cement, maybe we need some edge and bonding, and sometimes we need a flowable to make sure that we bond it a bit better, or maybe make some small corrections if we have some air bubbles or anything. Well, first I would like to go over the first scenario that we might encounter, which will be the single tooth with a retentive preparation. This is usually the easiest temporary restoration to make. As you can see, we have a full crown that needs to be redone due to aesthetics. This provisional is quite easy. I make a body index over the initial situation, and if I have the final preparation, I will have enough retention on this tooth. This crown or this temporary crown will be 360 degrees around, so I will get enough retention. I can just use a normal temporary cement to lute in the temporary restoration. What's important to remember is that the material has a little bit of a shrinking effect. So if I let it sit on the tooth for too long, it might shrink that much that it's stuck on the tooth. Is that a problem? Sometimes not. We can just leave it, let the patient go home, and let them come back later. What you genuinely want to do is to remove the temporary restoration because it might have shrunk too much around the tooth that we cannot remove it all at once and we need to destroy our temporary restoration. So my ideal situation would be to let the material set that it isn't deforming anymore, but I can just take it off. And then during the final setting, I will take it off, put it on for several times, just to make sure that it's completely set, but still I'm able to take it off. Then I can also trim the restoration. So we see on the left, we see the preparation. We see the provisional restoration. I can trim it out of the mouth, and then I can lute it in with some temporary cement if needed. And sometimes it has enough retention already that we don't need any temporary cement. So these are more of the easy cases that we do. But what if we have a non-retentive preparation? Because those are the difficult situations, because those are those temporary restorations where your patient calls 1 hour after treatment. Hey doctor, my temporary restoration fell off. And you don't want to put it on too good, because then you need to remove it again and maybe you need to drill it off. So this is one of the hardest provisional restorations that are there to make. We don't have that much retention that we can rely on. And we cannot really use a temporary cement because usually these veneer preparations are quite thin. So if we use a provisional or temporary cement that has some color in there, we might see it shine through. So what can we do in these cases? Well, like I already said, the material will shrink a little bit while it sets. So we can use that shrinking effect to our benefit. And we can just let it set completely and it will shrink a little bit around the tooth. And then it will be difficult to remove. So usually I just let it shrink and let it sit on the tooth and I don't touch it anymore. I remove it at the day of delivery of the final veneer, but then 9 out of 10 times I have to destroy my temporary restorations. In some cases where I need some additional adhesion onto the tooth, I can use a spot point and a spot etch technique. That would mean that I use a little bit of etchant on the tooth. I will let it sit somewhere between 15 to 30 seconds. I will rinse it off and only that spot will be etched. So we see a little white spot on the tooth. Then I place a tiny drop of bonding, which I will then light cure, also on that spot. And then I will make my provisional restoration and let it shrink and fully set. So I won't remove it off the tooth because then I don't have any retention anymore. It's important to know that this bonding will be on the tooth, so you need to remove it before you place your final restoration. Because if still a little bit of your provisional restoration is left, you might end up with the problem that it's stuck on a tooth and your provisional won't really fit. Or even when your veneers are really thin, you can even break your veneers. So that's something that we want to avoid at all times. If we take a look at multiple teeth with retentive preparations are quite easy. So for example, the case that we have right here, you see that I have multiple preparations. It's just enough retention. It's quite easy to make the temporary restoration, similar to the single tooth. The only thing that's important is that the axis of all the teeth are different. As you can see right here, there are undercuts from tooth to tooth. So we have different undercuts, which means I cannot put it on and take it off. So I need to let it set completely because due to the undercuts, I'm unable to take my temporary restorations off. So I will place my putty index, I have my provisional material, and I will let it fully set and remove any excess. And I need to cut them off at the day of delivery. So there's no way to get them off in one piece. I need to use a burr to at least make them as separate crowns, and probably I will have to break them up as well, because due to the shrinking effect and the fact that my preparations are quite parallel, they're just stuck on the tooth. So here we can see the different preparations that we have. This was a full mouth case, so the back teeth are still in the provisional restorations. Now the front teeth are prepped. We can see that there's a difference in the axis of the teeth, and you can see the provisional restorations on the right side. Patient goes home like this, but when they come back in to place the final temporaries or the final restorations, I need to cut my temporaries off. So that's important to know. And then the final scenario is multiple teeth with non-retentive preparations. These are quite difficult. We don't have that much retention and we cannot really use any temporary cement because we have the arch form. Therefore, we also have a little bit of undercuts, so we cannot take our restorations off. And if we take them off, they will be really thin and flimsy and really hard to put back. So what I would do in these situations is get my putty index and I would fit it up with my provisional material and I will let it fully set again. So just let it fully set, and hopefully the shrink wrap effect and the fact that there are some undercuts will make sure that my temporary restorations will stay in place. You cannot remove them, so these also need to be destroyed at the day of delivery or when your patient goes to the dental technician for the trying in of your restorations. Sometimes in cases you can also use a little bit of spot edge or spot bond just to get a little bit more retention. And as you see right here, I use a really tiny drop of edge, but in most cases I use a little bit more. I make like 5 different drops on the tooth. As long as I take a photograph of the place where the edge is, I also know the place where I need to remove the bonding that I also use. So you can use this to your benefit to get a little bit more retention and avoid that your patient comes back and says, yeah, sorry, my professional restorations came off. Because that's always the balance that we're in. We want to make provisional restorations that stay on the teeth the entire treatment, but we don't want them to be too stuck on the teeth. So we want to be able to take them off, but not that the patient comes in the meantime and just fills up your program over and over again because the professional restorations come off. That's always difficult. Then we have another scenario, which are the provisional restorations to guide any soft tissue. In this case, you can see that there's a patient that has a difference in the shape of his front teeth. We can see that one central incisor is a lot wider than the other central incisor. We can also see that there are different levels of the gums. And in this case, we decided to do a clinical crown lengthening in combination with slicing of the tooth. So on the left photo, we see the initial situation. Then we see where we want the gums to be, do the gingivectomy. Then we slice the tooth that's a little bit too wide, and then I place my mock-up. So I use the index that has been made on the wax-up, and I place it on here to guide me for the clinical crown lengthening. So what I do, I make a flap, and with the provisional restoration in place, I can see where the margin of my new restoration will be, and I can make sure that I have enough space between my margin and the bone. So the clinical crown lengthening is done, the provisionals are now taken off, I can put them in, take them off, just to do my procedure. Then I will place my provisional restorations again. You can see on the left, I used a little bit of flowable on the left slide, on the papilla, just to get a little bit of a better shape. You see that the stitches are there, and then after 2 weeks, I see the patient again, the stitches are removed, and you can see that the mock-up still looks okay, but not that well. Then I replaced the mock-up, and then I saw the patient again 4 weeks later. And you can see that we use, in this case, the temporary restorations to guide the soft tissue. So we use the temporary restorations, we use the shape, the position, to make sure that the gums end up where we want them to be. We will let this heal over a period of 3 to 6 months. Then we will take it off, make a new mock-up again to check if all the soft tissues are in the right order, and then we can continue with the definitive restorations. Well, for this lecture for today, I unfortunately only have 15 minutes, and this is a topic that I can go on for like forever. So there's a lot more to talk about. And this topic of provisional restorations is one of the subjects that are covered in the Karma Maarten's course. The Maarten's course is a 2-day indirect course where we talk about all scenarios in the posterior and anterior region regarding porcelain restorations. So if you're interested in learning more about that course, take a look at our website, karmadentistry.com. And for now, I would really like to thank you for your attention. And if you would like to see more of my work, you can scan the QR code, or you can find me on Instagram as The Dental Dutchman. Thank you very much.